Welcome to Take Charge with Dr. Chichi, where nurses take control, break barriers, and build a future of financial freedom and career success. Whether you're burned out, ready to level up, or looking for the blueprint to thrive, you're in the right place. It's time to lead, grow, and win because your future starts now. Here's your host, Dr. Chichi.
Hello, everyone. Welcome back to Take Charge with Dr. Chichi, the show where nurses and healthcare professionals reclaim their peace, power, and financial future. Whether you're feeling stuck, overwhelmed, or ready to take bold steps forward, this space is for you. Let's grow, lead, and thrive together. I read an article on Forbes titled Growing Burnout Crisis has men yelling and women leading by Christine Michelle Carter. She presented that a recent data from a career resource site, My Perfect Resume, found out that 88% of workers are burned out, which leads to troublesome behavior, a volatile workplace, and this burnout impacts their personal life. Men and women experience burnout, all right, but may handle it in different ways. Men are more prone to vocal outbursts, such as yelling or threats of resignation, but women may handle their stress or burnout by abruptly leaving their workplace or withdrawing from meetings. So, a journal I also read on the American Medical Association website presented that nearly 55% of women are feeling burned out compared to 42% of men. The point is that men still experience burnout as well. So the goal of this show is to raise awareness about burnout and encourage nurses and other healthcare professionals to take charge of their lives before it's too late. This is a crusade to ensure that every nurse or healthcare professional experiencing burnout who listens to this show will hear people share their story or fellow healthcare professionals share their stories, and then they can decide on how to take charge of their lives. So let's join together on this crusade of no nurse or healthcare professional left behind. So how are we going to do this? What you need to do is to share, give a thumbs up, send your comments, or subscribe to Take Charge with Dr. Chichi so you'll be notified when future episodes are released. So the theme for today's episode is Leading with Innovation, Burnout, Resilience, and Transforming Patient Care. On today's show, I am honored to have Dr. Andrew Awoniyi. I talked to Dr. Awoniyi and I said, it would be nice to have you on this show. And he said, Chichi, I'm coming. Dr. Awoniyi is a national nursing informatics leader with over 25 years of experience in various healthcare settings. In his current role as a vice president of patient engagement analytics, analytics, that's like a tongue tie at Axxess, the leading global technology platform for healthcare at home. He has developed and implemented the groundbreaking consumer assessment of healthcare provider system solution, which is CAHPS. So this solution enables care at home organizations to closely monitor and analyze patient experiences and quality scores in real time. Dr. Awoniyi holds a doctorate in nursing and in board certified in nursing informatics, and is board certified in nursing informatics, specializing in health informatics, health administration, chronic disease management, and home-based care. He has personally experienced burnout at some point in his career and has powerful insights to share. So I am so honored to have Dr. Awoniyi on the show. Great to have you here.
Good day, everyone, and pleasure to be here. I guess if we were on TV, I'd come dancing down, and waving to everyone. So hello, everyone.
It's good.
It's an honor to be here on Take Charge with Dr. Chichi. Thank
Yes.
you for the invite. I'm glad we were able to get together and talk about burnout.
Yeah. So I know what you share today will inspire or touch someone's life, you know. So happy to have you here. Thank you so much. I would have been dancing too while you're dancing down.
There you go. That's right.
All right. All right, Dr. Awoniyi, could you share your journey into nursing informatics and what led you to your current leadership role?
Sure. So I think my journey into informatics starts with just the fact that I've always been interested in healthcare. Um, Grew up around family members that are in healthcare. My mom has been a nurse ever since I was born and before. I have various family members who have been in healthcare. Was encouraged myself to go into medicine. About it, decided not to go into medicine, but always very interested in the human body, biology. And so my goal at the point in time was to get into research, do basic science research. And along the way, I ended up falling in love with technology, especially in the area of computers. I was blessed to have someone who served as a mentor, introduced me to computers when I was a teenager, started working with them, and really enjoyed the ability to use a computer to do things. Um, Along the way, I also found my way into nursing. No regrets there. So I ended up combining my interest in technology, leveraging technology, and really being able to apply technology to improve healthcare. And so that's the short version of my journey into nursing informatics. And I think from a leadership perspective, you know how sometimes people recognize things in you that you might not recognize in
Mhm.
yourself. And I've just found myself in positions where I've had to lead, or you raise your hand and go, "Oh, that shouldn't be that difficult." And then along the way, you're like, "Oof, maybe it's a good thing I didn't know what I was raising my hand for because maybe I would have kept my hand down." But
Down.
um, so yeah, so I've been privileged to really spend time with um, a number of leaders who have really helped me grow personally, and those who have invested in me along the way. So that's the short version of my journey into healthcare, nursing informatics, and into leadership.
Wow. I know your mom will be so happy. She's, she made you get into nursing. She
But
probably
funny,
must have inspired you, right?
you know how, to tell the truth, it was almost like nursing snuck up on me in the sense that I didn't set out to be a nurse.
Yeah.
That was definitely not a career option that I was interested in or that I pursued. But you're correct. I think
She'll be happy you did that though.
she was. I think because of the informatics piece, it took her and my father probably 2 decades to figure out what it is I did. They were like, "So what do you do again?" I'm like, "Well, I'm a nurse." Oh, okay, okay, we know that.
We know that. Then the second part.
You know, you don't work in a hospital? I said, no, but yes, I have worked in hospitals. Okay. So what is it that you do? Do you see patients? I go, I take care of, I support the people who take care of patients directly.
Right.
You know, that's my area of practice. So I think
Yes. Yeah.
finally my dad said, so you do computers in nursing? I was like, yes,
Yes.
let's just keep it at that. So, but it's there. I think they've seen me use some of my clinical skills, been
Mm.
involved
I
because
always tell people, I said, nursing is so good because you can do anything with it.
yes,
You can
yes,
do anything. I
very
mean,
true.
after being a nurse for 35 years, I never knew I would ever be doing informatics because, of course, that's my specialty too.
Yes.
I was a midwife for so many years.
Hmm.
I mean, I did um, different roles, different specialty in nursing. was a midwife in Nigeria before I came to this country, and lo and behold, now I'm doing informatics. It's
Informatics.
really, yeah, it's really amazing. So you've worked in diverse health settings. What experiences have shaped your leadership approach the most?
I think, you know, I would say all,
Hmm.
like they say, we're a reflection of all the experiences that we've had, whether it's in our conscious awareness or not.
Hmm.
So I've worked in the acute care setting, didn't spend as much time there, but uh, I did. I'm comfortable around the acute care setting, worked on med surge, telehealth, um, cardiac step down.
Hmm.
So I've had my share of experience there. I've worked in more of a public health slash ambulatory care setting.
Hmm.
So that primary care slash community health nursing um, has been something that I've done. I've done program development. So I would
Wow.
say all those things. And then from an informatics perspective, you know, did elbow support for EHR
Mm.
rollouts. I've been involved with implementations, redesign of workflows, training, I've done a number of things. I won't claim to have done everything, but
But at least in
I've done
almost all
enough
the specialties,
to
you've touched
yeah,
a little bit of the specialties. Yeah.
yeah,
Yeah.
yeah. OB was a challenge. I didn't work in OB, but I remember my OB rotation going through nursing school. But I
Yeah.
think one of the things and I've worked both in rural and urban settings,
Wow.
call that out because I think there's there's a perspective that some of us have. If we've never really worked in a rural setting, we don't really understand the challenges of
People have,
distance.
that's
When
right.
you live or work in an urban setting, you have a pick of, in some cases, three, four, five, six, seven healthcare systems as a nurse that you can work in.
Mm.
But when you live in a rural area and you realize that there's only one um, major acute care setting, a community health hospital, and if someone has a very serious injury, they either have to drive them via
Mm.
ambulance to
A
um,
bigger setting.
yes, a tier one
Mm.
trauma center, if it's trauma related, or helicopter them out. You begin to realize that being able to drive around the corner to your emergency room
Hospital.
in 15
Mm.
minutes or 30 minutes or less is not the same when you have to drive for 2 hours just to get to that level of
Okay.
care. So
Mm.
um, I think leaders need to understand, and if I guess everyone's a leader, the question is to what extent are you stretching yourself? But I think those are some of the experiences that have really helped me appreciate, just the challenges that some people face. So if you happen to be discharging a patient, they live 3 hours away,
Mm.
happen to have been admitted into an acute care setting, and you're giving them instructions, you're trying to ensure that they have all the supplies that they need. It's not as easy as, oh, we'll try and drop some stuff off. They live 3 hours away.
Hmm.
Um, it's the middle of the night, or maybe they don't have something. So I think just thinking about those pieces, even as a leader and supporting your staff as they take care of patients. But if you're leveraging technology, being able to um, make it much easier to run through, determine what is needed, being able to have algorithms that call attention to the fact that these are services that this person will need, and maybe trying to find, their closest service provider. All things that I think continue to shape our thinking and our approach to leadership, and ensuring that people receive care which ensures that they can continue to remain independent and is the best care possible. So kind of a longer answer, but
But
those
that's
are just
that's the main
examples.
thing. Yeah.
Yeah.
When
But
you're talking about experience that shaped your leadership, it could be a whole bunch of experiences you've had. So it's
yeah.
also good to share it. So people, the goal is for people to listen to the show and get something that will help them to make
Mm.
their own decision.
To take
Or,
charge. Yeah.
yeah, yeah, take charge or shape their journey too.
That's
So,
true.
yeah, so most healthcare professionals that I talk to will always tell me, when I ask them, have you ever experienced burnout? Their response usually is almost all healthcare professionals have experienced burnout. So the reason for this show also is to create awareness about burnout. And I know I've talked about this with you, and I know burnout is real and is one real challenge for leaders too. So can you share how you experienced it and how you addressed it?
Yeah, it's interesting when you studied the show this evening and you talked about the studies around how how different genders approach burnout and stress and as individuals, I would say I'm sure I've experienced burnout.
Hmm.
I I can't think of a specific example where I was like, I'm done. I'm taking 2 weeks off. Nobody called me, and I crawled into a hole, and was unreachable. But maybe I wonder, is that related to my acculturation as as a man or as a male, where you never experience burnout, even if you have a weakness, you don't show it. But as a leader, you understand that being able to show vulnerability is critical um, to really working with a team. And so, what I would say is probably my burnout experiences have probably been more, I would say, low grade burnout. And what I mean by that is there are just times when you're tired.
Stressed.
You know what? Um, you're like, can I deal with the situation? Um, where you're trying to solve a problem. I think um, one of the things that has probably helped me is my focus has really been on this too will pass.
This too will pass. Yeah,
This too will pass. What's the worst thing that can happen?
it will pass.
And once you think about the worst thing that can happen and you really think about it, you go, okay, will this thing kill me?
I know. What
Okay.
what doesn't kill you makes you stronger, huh?
What if this thing doesn't kill me, then it'll make me stronger. I think that's one. I think the other piece is just having mentors along the way
Yeah.
who point out that, if you want to do anything good, it's not going to come easy. If
Hmm.
it were easy, everyone would do it, and realizing that second mile or the third mile um, is where a lot of people won't go. So I think the idea of burnout is real. I think really working to ensure that we guard against burnout. So for me, part of what they talk about with burnout is lack of sleep is critical. So one of the things that I'm fortunate and I've always worked on is if I'm not sleeping and something's keeping me up at night, um, then I have a checklist.
Hmm.
First question I ask myself is why am I awake and what is it that's
Hmm.
keeping me awake? The second question I ask myself is, can this thing wait till morning? Is there anything I can do about this during the middle of the night when I'm awake? If there's nothing I can do, and I'll run through the inventory of what can I do about this right now? If I cannot think of anything, and if I do, and it's not something I can do, let's say at 1 a.m. or 2 a.m. or 3 a.m. in the morning,
Hmm.
then I'll make notes to myself or make mental notes and go, okay, this is what I can do. But right now, what I need to do is sleep.
Sleep.
You know, um, Sleep deprivation is a form of torture.
Hmm.
When you read about how people are tortured, and I hope anyone watching this doesn't get the wrong impression. I don't go around reading about torture. But when you really look at stories of how people are tortured, the lack of sleep, sleep deprivation is one of them.
Mm,
So anytime I find myself sleepless, I find myself going, oh, I
mm.
don't plan on being tortured because we can't think straight. We can't function at the highest level when it comes to problem solving from the lack of sleep. The other thing I focus on is making sure that, so what I didn't mention is I go back to basics. Am I sleeping well? Am
Hmm.
I well hydrated? Am I paying attention to my nutrition? Whether it's even if I don't have an appetite, do I
Hmm.
at least make sure I get my basic nutrients in? Get a veggie, get a fruit, get some protein on board.
I know you're the fruit guy.
And then make sure that I'm also physically active. You
That's
know, um, part of what they talk about with, um, and I'm speaking about myself,
about yourself. Yeah.
physical activity. Physical activity raises your endorphins, increases oxygenation. It
Hmm.
truly does make you a lot more attentive. There's a lot of research around that. So I would say those are the things I found myself falling back on when I found myself extremely stressed or dealing with situations. And then I would say really reaching out to my network, really
Hmm.
going who best to help me with understanding this issue. It might be a little kid where you're like, let me try and explain something to a young child in terms that they can understand. The
Wow,
process of
never thought
doing
about
that,
that.
yeah, in the process of doing that, you find yourself having to break down very complex issues and realizing maybe it's not as big a deal as I
Hmm.
think it is, or by reframing it, it allows me to approach it. So I would say those are some of my challenges. I would say the other end of that is, just supporting team members who are dealing with burnout and helping call it out. Like you have a lot that's going on. I recently had someone on one of the teams I work on who over the last year had lost family members,
Mm,
lost a sibling,
mm,
had lost an aunt, had
mm,
dealt with some major trauma, but continued to show up
mm.
work. Finally, ended up deciding to take off some time. And I was in full support of it because I
Yeah.
said, take care of yourself.
Take care of yourself.
Take care of yourself. You know, did was it like, oh, you gave them unlimited leave? No, but it was from a perspective of really trying to understand and support that person and not have them stress about their work. The caveat there is there was somebody who performed at a fairly high level, so there wasn't any concern that they were simply trying to take advantage of the situation. So I would say that that's the other half of it,
Hmm.
recognizing burnout in ourselves, but also recognizing when members of our team, whether it's colleagues or those who report to us, the colleagues as well, when they're going through things and really being able to support them and make progress,
Yes.
even if they don't realize that what they're dealing with at that point in time um, is burnout.
Yeah. You people haven't talked to a lot of people. People bring different perspective on how they experience their burnout. And I find out that different people have different stories that they tell about their experience with burnout. That's why, like I said, I had in mind of creating this show where people can come and share their stories. Because you sometimes if you look at research, sometimes when people are going through burnout, they don't even know. They don't know. It's after the fact that they're like,
Yes,
oh my goodness, is that so you just talked about your colleague, but can you imagine that person? Like they said, burnout is like one of the people I had on the show is like when she described it, she said it's like a drip of water, and that drip of water keeps on going. And by the time you know it, it fills up
that's an
a
excellent.
basin or
Yeah,
fills up something, and then is about to burst.
yeah,
So we have to, you talked about self-care. Self-care is very, very important,
yeah.
and we need to, the only thing I have to say, burnout is real. So we need to
It
take care
is.
of ourselves. Yes.
I agree there. I totally agree.
Yeah. So some people that I talked to said that the reason why they stayed in the environment where they're experiencing burnout was because of financial responsibilities that they have. So I guess I asked everyone this question. Did financial responsibility influence your decision to remain in your role during the time you were experiencing the burnout?
Yeah, I would say finance, and I think a lot of us have a very strong sense of responsibility.
Hmm.
Not on my watch. I mean, I think in quotes, not on
Hmm.
my watch.
Hmm.
I'm not going to be the one that quits. I'm not going to be the weakest link,
That's
right?
right.
You
That's right.
know, and I think the sense of responsibility in terms of if I don't do it, then who else is going to step up, either in our family? Uh,
Hmm.
I think part of the challenge a lot of families have um, is they are two income households. Lifestyle is built around double income, or in some cases, it might be single income,
Single
which makes it
income.
that much more challenging. So that sometimes when we do experience burnout, we're thinking about the finance, but I think sometimes what trumps that is our pride in terms of I'm not gonna give up. I think the immigrant story is one of um, overcoming overwhelming odds. If
Hmm.
somebody if somebody told you, okay, you know, I'm going to pick up and I'm going to move to Antarctica because I've heard that yes, it's cold, but there's gold underneath the ice. I'm going to get rid of everything I have. I'm going to buy a one-way ticket and I'm headed to Antarctica. All of us would look at them like,
What's
have
wrong
you
with you?
been to Antarctica? Do you have family in Antarctica? Well, yeah, no, I don't really have family. We'll look at them as if they're odd. The immigrant story, I mean, we believe that, whether it's Europe or the United States or Canada,
Hmm.
that things are better. And they are to a certain extent. But really think about the immigrant experience picking up, traveling 3,000, 4,000, 5,000, 6,000 miles. Even if you do have family there, starting life all over takes a lot of
Hmm.
mental resilience. And I feel like when you think about that, you find the person gets there. How many of them turn around and go, hey, I can't do this anymore. I'm done. Everyone will look at them like,
There's something wrong with you.
yeah, yeah, the one that said you wanted to come. So I think we sometimes forget that for those who are immigrants, and even if you're second or third generation, there are just certain things that have been drilled
Yeah.
in order to be successful, to get to where you're at. It's extremely difficult to say, time out. Um,
And
I
then
need to take a break. We're like, okay, well, I just need to get past the next hour, need to get
this too
past
shall pass.
the this too shall pass. And sometimes we really do need to go, look, I need to stop and do a water break. It's a marathon. I mean, it's not a sprint, and I think like you said, when do we need to take time out and just go, I need to take care of this in order for me to be able to keep running and not stop. So go, I need to take care of this in order for me to be able to keep running and not stop. So
I think the most important thing is if somebody is experiencing burnout, get help. You know,
yeah,
the kind of upbringing that I personally have, I guess because of you talked about immigrants, is pray about things, tell God about it, work hard, do whatever you need to do. This too shall pass. I like when you said that, and it's made some of us stay in an environment that when you're driving, like let me tell you what I used to say. When I'm driving to work, I used to say, I'm going to a war front. And then I pray while I'm driving to work. But I'm telling you,
oh,
get
wow,
help if you need help.
absolutely.
Yeah.
Yeah. Yeah, and it's important to have, I agree with you. It's important to have those friends
Mm,
that will tell you the truth even if you don't want to hear it,
that's right.
you know, where you need to pause and listen to what they have to say and go, okay,
Hmm.
maybe I do. Maybe, okay. Yeah, maybe I need to see it from their perspective. But
That's right.
yeah, I believe in the power of prayer, uh,
Hmm.
and using that as a way to fortify the mind and not using it solely as a crutch. Because I think sometimes people say, Hallelujah, I prayed about it,
Hmm.
everything's fine. It reminds me of the story. Schultz, you might have heard it or various versions of it. There
Hmm.
was a flood. This I'll use the example of a man. He got on the roof of his house because the water was starting to rise. Well, he went from the first floor to the second floor.
Oh, and help came, right?
Praying. He was praying, and he heard some people shouting outside. He climbed up on the roof, and they were like somebody in a canoe. And they said, "Oh, we have room in the canoe." I said, "Oh, no, no, I've prayed about it." And and they were like, "No, but we can take you to safety. The water continues to rise." It's like, "No, no, I've prayed about it." Then they leave. A speedboat comes by. They offer him a ride. He's like, "No, no, no, I've prayed about it." And then the next thing you know, um, a helicopter comes by, and they're like, the water continues to rise. He's almost at the top, and he keeps praying fervently. And the helicopter comes and he gesticulates to them and says,
He's
"No,
praying
no, I'm
about it.
good. I've prayed about it." And they're going over there. They're like, This is like, no, no, I'm good. I prayed about it. I believe in the power of prayer." And next thing you know, the water rises up. He gets swept away. He finds himself at the pearly gates. And, this is allegory. He
Yeah.
finds himself at the pearly gates and he's like, "What am I doing here? I prayed about this." And they said God's response was, "Well, I answered your prayer. I sent a canoe, I
That's
sent
it.
a speedboat, I sent a helicopter, and I mean, what else did you expect me to do?" I said, "Well, I thought you were going to call." It's like, look, I sent you all these things. That story has always stuck with me from the
Yes, yes.
perspective of there are times when we are praying or we're seeking answers to things and the answers are
Right
presented to us
then.
on a silver platter, slid in front of us, and all we need to do is reach out, grab it. But because we're expecting an answer to something in a certain way, it clouds our perspective.
Hmm.
So anyway, I share that to say, yes,
Get
I believe
help.
in the power of prayer, but I also believe that prayer is answered in a number of different ways, and sometimes it's people who are close to us or
Hmm.
not. It might be a total stranger that comes up and gives you a word, and you recognize that that's the answer to what I was looking for.
That is the reason for this show. People
There
go
you
through
go.
stuff. Like I said, people
That's
go through
right.
stuff. Burnout is subtle. And so when somebody listens to this program and hear people sharing their perspective, when you were talking about how you experienced burnout and what you did, it might be that aha moment that will make someone to help make a change and go get help. So I like this story that you told. I've had someone tell that story, but whenever I hear it again, it brings a different perspective to the experience. But thank you so much for sharing that wonderful story. So, Dr. Awoniyi, let me ask you, what advice will you give to a nurse or healthcare professional currently experiencing burnout?
The advice I would give is just like we've been saying, ensure that you build a support system. It's not it's not when you start crying wolf that you expect to start making friends in order to get help. Um, there's a saying in Yoruba that's um, if you want to step on cool ground, you need to pour water ahead of you.
Mm,
And I'm sure that there are different versions of that. You, if you want support, you need to be supportive. If you want to have friends, you need to be friendly.
Mm-hmm.
It's along the same lines. My advice would be make sure that you have genuine relationships where you can be open with people and they can be open with you. It's not everyone. They talk about most people will have maybe about 10 to 15, I think it's 10 to 15 people who are very close to them. Whereas there are people who will, you know, who are still in your circle of influence, but you're not as close to them, and people will move in and out of your circle of trust. Um, and so I would say ensure that you hold your friends accountable, just like they hold you accountable.
Mm-hmm.
I'd say the second thing is, build ways to recreate. So they talk about recreation or recreate. Recreation is from recreating, looking for a way to wind down at least once a week. There's a concept of Sabbath, which is rest.
Mm.
Some people pick a day, if it's a day of worship, it could be Saturday, it could be Sunday, it might be Friday if someone's Muslim where they go and pray. But picking a block of time where you disengage and you build in some traditions, finding quality time with family
Mm.
and friends and just turn off from work and really truly recreate. Go hiking, paint, write poetry, sleep. Some people just don't get enough sleep, and then everything we talked about before. Are we focused on a healthy diet, a healthy meal plan and menu? Not diets. The word diet crept in because it's easy to say diet. Diet seems to be very strict,
Mm-hmm.
but is it possible to eat healthy and slowly over time incorporate more healthy items? Some of us are picky eaters, so maybe it's narrow, but we've got to be willing to at least eat healthy, even if it's narrow, and try and find variety, vitamins, especially as most of us grow older. We can't eat all the nutrients that we need. It's a documented fact that farm to markets is much longer because of logistics. So, and you can't grow everything you want in your backyard. So unless you're a horticulturist and you understand all the micronutrients and macronutrients that need to go into growing your food, you're probably not getting all the nutrients you need.
Mm.
But you eat, therefore, using supplements in a measured fashion
Mm-hmm.
um, is helpful because sometimes it's micronutrients we need,
Mm-hmm.
potentially feel better. Then obviously being physically active, dealing with stress, continuing to learn and grow
And
so that we
grow.
can find ways of being fulfilled. I think there are ways that will help ward off burnout. And then learning how to say no.
Yes.
Because there are a lot of us who, can you help me? Oh, sure. And they're thinking to
Wow.
yourself, I probably shouldn't have said yes because I'm already double booked or even triple booked. But we say yes when we should have said, well, unfortunately, I can't help. But here is what someone can do, or this is what I can help you do. So learning how to say no, maybe not no all the way, but no, I can't help you with that. However, here's what I can help you with.
Yeah.
So I think there's a lot that's been documented around, how to work through some of those things in order to either be proactive about preventing burnout. And then once you encounter burnout, finding ways to pull yourself out of that, But we know that mental illness is real. We know
Israel.
that there are people who really deal with all kinds of things. The number of degrees you have, the prestige of the job you have, does not prevent anyone from being burned out. The
Mm.
bigger the things you do, the bigger the headaches, bigger the challenges, So I would say everyone's dealing with issues at different levels. We just need to continue to support one another and work on de-escalating those situations. And I'd say sometimes you need professional help.
That's
You know,
right.
I think in a number of cultures, seeking mental health is viewed as a weakness, is viewed as um, somehow I'm lesser than. But
Mm.
sometimes we do need professional help, and I'm looking for professionals who can help us work through it. I'm sure you have episodes and you invite others who can speak more eloquently to how to identify those kinds of resources on screen to work with someone who has a value system that's similar to yours, who can relate
Mm-hmm.
to where you come from. I think sometimes as immigrants, we struggle with someone who can straddle, whatever our default culture is, along with an American culture and really help us understand how to walk between both. In some cases, some
Culture.
people are dealing with three cultures. Maybe they're dealing with the spouse's culture and their native
Culture.
culture and,
American
living
culture. Yes.
living wherever they are living. So those are my thoughts anyway.
Well, that was a good one. When you said knowing when to say no,
You could relate to that.
I could relate to that because sometimes you have a lot
Yeah.
of stuff on your plate, or not just saying no, but say no, but I can help you with this. And then that way you can get self-help, you know.
Yeah.
So as the Vice President of Patient Engagement and Analytics, I always have a tongue tie when I come to that analytics because I think it's really a big role at Axxess. Can you please tell us about the groundbreaking CAHPS solution you developed and what inspired it and what impact has it had?
Yeah. So, um, but Access has been an adventure in itself. Um, Started working with the organization when it was smaller,
Wow.
not in full startup mode, but um, and the vision has been to really truly bring innovation to the care home industry,
Mhm.
an underserved industry. So with the CAHPS or the consumer assessment of healthcare providers and systems, um, the short version for those who might not be familiar is it's a patient experience survey evaluating the experience that patients have in healthcare settings. So there are a number of different CAHPS surveys. It originally started in hospitals.
Mhm.
So there's a CAHPS survey for hospitals, CAHPS survey for home health, hospice, inpatient, you know, um, in, in-center dialysis, ambulatory surgical centers, ambulatory practices, and um, part of what we had looked at Access was I was tasked with helping get that program going
Wow.
to figure it out, which is to identify what was required to start the program, how to administer the surveys, meet the requirements to get the program approved. Once the program was approved, how to be compliant, how to grow the program, develop the solution. So it's been an opportunity for growth, and I would say we can truly help um, support um, organizations that are delivering care in the home. So ensure that we talk about the value proposition, ensure um, support um, organizations that the solution was and is about capturing that patient experience of their care, delivering those results to healthcare organizations to ensure that they understand what the perception of their patients are about the care that they've received, and doing that in a manner that leverages technology. So that's been part of what we've done there, and obviously presenting the data in a meaningful way and ensuring that the organizations continue to be successful. So those are all the
Basically, it's a process to enhance or improve patient experience.
That's correct.
Yes,
And their financial impacts to
yes,
organization
yes.
uh, in terms of if patients don't have positive things to say about the organization, they're going to tell other people about it. They've had a positive experience, they're going to tell people about it, you know. Uh,
Mm-hmm.
the results are published by the Centers for Medicare and Medicaid Services, CMS. Uh,
Mm.
that impacts whether an organization will receive references and
And
resources.
reimbursement of what?
Yes. So that's part of what's involved with CAHPS. So it's helping organizations understand that and helping them leverage those results in a way that continues to ensure that they are successful. I
Yes.
want to make sure that I only, me and my loved ones only receive care from organizations that are
These are
doing the
rated
best
high.
out there. And
Mhm.
that's the goal of the quality reporting programs. And it's actually written into law, the Affordable Care Act, and
Mhm.
a number of other legislation. So,
So how do you see technology transforming patient engagement and quality of care, especially in home-based care?
you know, we talk to each other about the power of technology. I think
Yeah.
technology can be used for technology is neutral. Technology is neutral. It's a tool that's been developed. A hammer is lethal if used in the I believe technology is transformative the wrong manner. Or if a hammer misses a nail and gets a hand or finger, it's lethal. I mean, it causes significant damage. But the hammer itself is neutral. The hammer does not have a will of its own, but it depends on who's wielding it. And I believe technology is the same way. Some of the things that we see with X-rays and ultrasounds and MRIs and PET
Hmm.
scans, all that's technology. The ability to hang up an IV, control the flow rate, have
Hmm.
multiple medications going in that are titrated, you know, those are all as a benefit of technology. And I think when we think of information technology, large amounts of data are being captured, being able to find insights, being able to ensure that workflows are as efficient as possible. So in the old days, for those who've been practicing
Hmm.
long enough, when they remember when orders were written on paper,
On paper,
so all you had to decipher what was written. Is that
because the writing is so
two
bad.
pills? Yeah, is that two pills? Is that one pill? Is that 1 gram
And then you
or
give to someone else to
microgram?
read that and see if
Yeah, you
it's
know. And I mean, sad to say, there are people who had disability and death because of handwriting. And
that's
so
right.
you get past that, then you have that prescription sent to the pharmacy. Somebody has to read it. You know, how do you know that they received it? Well, that's if the medication comes up. If they didn't receive it, then there's a question of, well, did you send down the order? You're like, I sent down the order. So I think technology has helped streamline some of those processes. So I would say that technology has allowed providers to deliver better care. Um, it's allowed patients to
Hmm.
also become more empowered in the care that they've received, and really, in some cases, being able to get a hold of their provider, being able to read notes, being able to share the notes that they've received electronically. I'd say the flip side of that is there are instances where technology has not been implemented well, and therefore it's added to the burden. There's documentation burden for some people because they have a whole bunch of check boxes that they have to check. They have
Hmm.
all these notes that need to be written. The system's not intuitive. It doesn't preserve the previous notes, or doesn't allow them to
Go
easily
back. Yeah.
document. And so in some cases, it's really been a burden. All the system is really about billing. It really doesn't cater to the needs of the bedside clinician who's delivering care. So I think the benefits far outweigh the disadvantages. We still have a ways to go, but I think implemented the right way, technology improves how care is being delivered.
Wow. Wow. I was just listening and I see how you were breaking down stuff. So, Dr. Awoniyi, let me ask you this. What advice do you have for any healthcare professional aspiring to get into a leadership role in informatics? Or even what advice would you give someone that wants to get into informatics or
Yeah,
even the leadership role?
yeah,
You
that's
can
a
you can you can address both sides of it.
that's an excellent question. Let's tackle the harder one first, which is, or maybe it's the easier one, the leadership piece. I think well leaders, once we're willing
Yeah.
to take charge, continue to learn, and allow members of our team or our colleagues to perform at
Mhm.
their highest level. If what I'm trying to do as a member um, of the unit is to ensure that, let's say it's a med surg unit, that everyone who steps on the floor and that I have an opportunity to come in contact with will be better because they've encountered me. And that's what I focus on doing in support of my colleagues, then that's taking a leadership position, whether it's recognized and it's a formal title or not. So let's start with that
Mhm.
as a baseline, as a definition of leadership. I think um, whether one is doing it in practice or leveraging tools that allow them to do it better, I think that's taking a leadership position, raising their hands, speaking to what needs to be done, supporting um, changes that need to happen from a workflow perspective,
Mhm.
the rollout of a new piece of technology or a changeover in technology. I think that's taking ownership. And I think people who are interested in leadership in informatics, if they have leadership skills, they just need to beef up or learn more about informatics, improve their knowledge base, and basically have some people use the term hive mind, people who are technologists who can help them grow and grow their skill set. I think getting into informatics has been a challenge for some people.
Mhm.
Some have been fortunate enough to have opportunities open up. They put up their hands, they get recruited, and next thing you know, they're working on the IT team. I don't think everyone has had that opportunity. So what I would say is if it has to do with quality improvement, workflow, um, anything that has to do with
Mhm.
implementing new systems is an opportunity to gain additional skill sets and therefore add to your resume and understanding your knowledge base, how to leverage technology to make things better, how to improve um, systems and being able to make things better by the integration of technology. And I think so when a position officially opens up, some people are waiting to find a position that they'll then do on-the-job training.
Mhm.
However, OJT, but however, a, a lot of times organizations are looking for somebody who walks in
Already
and
have the
they don't have
experience.
and they have the skill sets. So once you recognize that, it's looking for opportunities to keep adding to your skill set.
Mhm.
Some people went, but I think you experienced it as well. There are people who went back to school, early, 2010, 2011, 2012, when EHR implementations was a hot thing. They went back, got their degree in informatics, and then they were like, where are the jobs? Where are the
Where's the
jobs?
job? I
But they
know.
didn't have experience, so there
Yes.
was a glut in the marketplace of a lot of people who had a degree, but they had no experience. They'd worked at the bedside. They just finished the degree, and depending on their degree program, they didn't really have a chance to really do enough to really help ground them in what informatics is all about. So I think it's become more difficult, but there are also opportunities. If we take the perspective that if you're a nurse, like clinician, you deal with data and therefore you're an informatician. The question is, how well have you developed your skill set? So if we think of beginners, novice to expert, an expert would be somebody, excuse me, who has developed a lot of technical skills, technical know-how. They've implemented things. They're an informatician in the true sense of the word, where they've integrated both their clinical and technical and um, informatics skill sets, workflow redesign, and all that. That's the high end, and that's the expert. On the other end is maybe a novice nurse. They know how to use a computer. They've typed papers. They
Mm-hmm.
still go through nursing school. They've done some rotations. They have an idea of how to do an assessment, how to document. But they're early in their journey. The question is, where on that continuum
Are you?
are we? And so for somebody who's looking to get a job, there's a good chance that they need to be, somewhere beyond the novice stage. They might not be fully in the expert stage, and they need to be able to speak to the experience and understand what the position entails, just like any other job that you're applying for. If you're trying to transition from OB to be a med surg nurse, you've never worked in OB, in med
A
surg,
method.
you need to be able to speak to how your assessment skills, uh,
Mm-hmm.
mother and infant translates to being able to work with a much broader set of um, pathological diseases and truly being able to take what you've done on the OB side and translate it into what you'll be required to do and translate it into what you'll be required to do on the
On the
meds.
acute care side.
Yeah. And I would say it's the same thing with trying to get into informatics.
Yeah, I was just listening, and it's interesting how you applied a theoretical framework to the discussion. It takes someone with a doctorate to kind of explain it in a theoretical way, like you applying theoretical framework, novice and expert, and then continuum. Impressive. All right. So, what does taking charge mean to you personally and professionally?
I think taking charge to me, I think taking charge to me, when you listen to motivational speakers, you know, the, the fundamentals of success, because I think taking
Mhm.
charge for what? Taking charge for success. So I think success is implied in taking charge. Well, we should say nobody takes charge because they're trying to get something to fail. They're taking charge because they want something
To
to succeed.
improve something. Yeah.
One of um, I think it was Jim Rohn that said it, a motivational speaker.
Hmm.
He said, part of the challenge we have as human beings is that we forget that we've been endowed with an unlimited ability to grow and change, with an unlimited ability to grow and change. He said, a tree is planted in one location.
Hmm.
Their roots can spread, but that tree is not going to physically move. It can't, as far as we know, it can't physically get up and move from its location to another location. Human beings, on the other hand, are mobile. If we
Hmm.
don't like the position we're in, we can change change that outcome in a way a tree cannot. So when I think of taking charge, that's really what I think of is
Wow.
having the courage to recognize that we have whatever our upbringing is, whatever we've been told, but realizing that we have in us an innate ability to accomplish incredible things. And I don't care, you know, whether you believe in God or you don't believe in God,
Yeah.
whether, at the end of the day, the intricacy of the human body shows a design that's beyond, I mean, we mimic nature.
Mm.
Somebody's, scientists have said, if you take just the human eye, that's just one simple system. If you look at the placement of the lens, you think about the fluid in the eye, you think about the optic nerve and where it's located, and it's located precisely. This is for billions of people that are
Mm-hmm.
that light comes in through the pupil, goes through the eye, is flipped upside down, lands on the optic nerve, gets transmitted into the brain, gets interpreted, and the image is reoriented, and that gets stored. That's just the eye.
Mm.
And we have two eyes. And if you think about the billions of people that are born with eyes that function normally, we find it hard to achieve that level of success repeatedly. And that's just one body system. Think of the the thousands, or if not millions of miles of nerve cells that innervate the whole body. What am I trying to say? Take charge.
Mm.
To me is about what is it that each one is supposed to bring to the world. Just take charge of your life. Take charge of making the world a better place, because no one, even your twin, was ever born at the exact same time as you are, precisely the same time. We know twins don't come out, they take one out at a
Well,
time.
not yeah.
Nobody can be born at the exact same time. Nobody has your exact same gene composition. Nobody um, nobody can do what you can do in the way you can do it, because nobody can occupy the same time and space as you. When you think about all those things, you realize that therefore there's no one who can take charge the way each
You
one
can.
of us can. So, what do I think of taking charge personally? Nobody else could have done this series on taking charge with Dr. Chichi the way you have. Nobody has had the exact same experiences that you've had. Even if they grew up where you were born, if they went to the same school you went to, they didn't interact with the same people.
That's right.
They didn't have your genetic makeup. They didn't, have the same number of kids or the same kids as you. I mean, there are just so many variables, but yet, um, we can support one another because we have shared experiences. So that's what I view take charge to be. Take charge of our lives and take charge of all the other wonderful people that are in the world. Yeah, the ones that are not so wonderful may cloud our judgment, but there's so many other wonderful people who are doing incredible things. That's take charge to me.
Wow, that's deep.
I'm sorry, I've
That,
been
that's
accused
that's
of that.
deep.
I've been accused of
It's
that.
always interesting listening to you when you talk. You bring, I don't know, you bring it's packed, it's always packed with wisdom because you find a way to give examples to draw what you're trying to say, to draw it together and give the concise answer to whatever question you're asked. And I find that very impressive. That's good.
Well, thank you.
It's
When you told me I was coming on the show, I was like, gotta bring my A game, gotta bring my A game.
all right.
Gotta-
So I like this section of the show, and that will be in my rapid fire questions. So
Mm-mm.
just one word to describe your career so far.
Ooh, one word. Okay. I'll try my best. One word to describe my career so far.
Yes.
Interesting.
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 That's the word, right?
Interesting.
Interesting. Wow. It should be interesting because mommy and daddy ask you exactly what are you doing? So it's interesting.
That's
So,
right.
so tea, coffee, or smoothie? I can guess
Tea,
that one.
coffee, or smoothie. I struggle because I would go with smoothie because smoothies allow for creativity.
Yes.
Tea does as well, but I'm going with smoothie on this one.
Smoothie. Okay, good. Is there any
Because,
special kind of smoothie? Vegetable
oh,
mixed with fruits?
there's no two smoothies that are the same.
All right. All right.
Yeah, green smoothies, fruity smoothies. I prefer my smoothies sweeter.
Sweeter. Okay, good.
Yeah,
All right.
but I'll do a green smoothie if I need to.
If you need to. Okay. So favorite tech tool or app you can't live without?
Mobile phone.
Okay.
Um, uh,
Communication.
it's communication tools, yes. With
Yes.
internet.
With
I need to mention
internet.
internet with internet.
Without internet, you'd be like, mm.
Hey, it feels like a brick.
Because you can
The
actually
paper one.
work if you have internet, right?
Hey, you can be anywhere
Anywhere.
in the world. You can
Yes.
be,
Yes.
and I mean, these days you can connect it to a PC or you can connect it to just a screen, connect it to a keyboard, and I mean, it's a computer. It really
It's a
is.
computer, mobile computer.
It's a mobile computer.
Yeah. All right. So what's next for you this season of life? Or I will ask either one of them. What's one dream you want to pursue?
Um, so I think this season of life, and I mean, I think we need to do it all along, but I think part of it is just continuing to give back.
Give back.
And then I would say the dream is, to really make a difference, seeking to make the world a better place. Some people say, oh, the world will continue to get worse.
Hmm.
Um, Maybe that's the case, but it doesn't mean that because of that we'll fold our arms and lay down and go, well, it's going to get worse. Therefore,
You
you
won't
know,
do anything.
yeah, I think that's really what Take Charge is all about.
Take
You
charge.
have good days
Exactly.
and bad days. You live for the good days and you work through the bad days to get to your good days.
That's
The
right.
sun will come out. I believe that. The sun will come out.
Thank you so much, Dr. Awoniyi, for coming to the show.
Ah,
Thank you. Thank you. I really
thank you,
appreciate you.
Dr. Chichi. I appreciate
Thank
all you're doing with the show. And
thank you.
I believe when you do some of those shots, I'm sure there are people who will see shots and go, I need
Mm,
to watch the whole episode. Oh, I need to follow the channel.
that's right. That's right.
Um, so thank you for having me.
I'm planning to do that one soon. And I
Um,
know with tech people around me like you're gonna help me with that too.
hey, you know you can call me. I'm more than happy to help. I will say no to the things I can do, and I'll say
I
yes.
know.
I will say yes to the things I can.
I can do. Okay. Okay. Thank you so much for coming, Dr. Awoniyi.
Thank you.
So my reflection prompt today will be, are you sacrificing your peace and purpose for productivity? What boundaries can you set this week to protect your mental, emotional, and spiritual health? What part of Dr. Awodiyi's story resonate with you? How can you begin taking charge of your career, health, and mindset today? Just write it down, commit to it, and take charge. Another question I have is, if something happens to you today and you're not able to walk, how long can you sustain yourself? Just email me at takechargewithdrchichi@gmail.com. Take charge with Dr. Chichi at gmail.com. Let's talk about it. So thank you, Dr. Awoniyi, for joining us today and for sharing your inspiring journey. Your resilience, honesty, and leadership will surely empower many health professionals who are navigating burnout and searching for direction. Dr. Awoniyi, thank you so much once again. And if Dr. Awoniyi's story resonates with you, share this episode with a friend, family, or colleague. Any of your colleagues, just share with them. Don't forget to subscribe, leave a review, and follow us on YouTube at Take Charge with Dr. Chichi. Remember, burnout is not your identity. You're not alone. You were created for more peace, more purpose, more power. You have a power to rewrite your story. Don't settle. Take charge. Take charge, because your future starts now. Your well-being matters. Your purpose is too valuable to burn out. Until next time, take charge and bye.
Take Charge with Dr. Chichi is a brand of Sparkling Star Development Strategies LLC. The information provided is for educational purposes only and does not constitute financial, legal, or medical advice. Financial services are offered independently by Dr. Chichi in accordance with applicable licensing and regulatory standards. Thank you for watching.